morning, everyone, and welcome to our second day of the EPH conference. I'm Natasha Tsopardi-Muscat, President of the European Public Health Association, and I shall be co-moderating this session together with Isabel de la Mata from the European Commission. And this is in fact our joint EUFA European Commission plenary for this year. Of course, Europe has made great strides in improving life expectancy, yet we do see that this is actually stagnating in some countries, and definitely when it comes to health inequalities, I'm sure we have to humbly acknowledge that we are not on track in the way that we would like to be. I'm sure that as you are preparing for the next 5 years of the Commission, you face a formidable agenda in front of you with communicable diseases that are re-emerging, and also with the commercial determinants of health, tobacco, alcohol, and others, which still remain so important and require further efforts. So today we thought that we would take a look at the next 5 years and what EUFA and the European Commission are planning and how we can support each other in order to achieve the objective of improving health for people in Europe. Isabel.
So we have some old challenges that still persist, and we have new challenges. As Natasha has said, we have the climate change that is more and more an increasing problem and a challenge for public health, for health in general. We have the urbanization, the migration that we were discussing yesterday. We have the aging, some diseases that are changing in the patterns and that are increasing in numbers. This is also a special year because we have a new director of WHO that was yesterday in a session. We have a new European Parliament, and we will have, I hope, a new commissioner next month. But we have a new commission, and we have also a mandate. And also for EUFA is a turning year because you are discussing the new priorities for the next period. So the key question is where we should go, but how can we do that? Because we need to be realistic and what we want really to do. And this is why we have a panel with 4 different representatives. So, Natasha?
Yes, we're delighted that we have 4 women with us here this morning, all in their various different positions. Anne Boucher, Sarah Mcqueen, Dineke Zigas-Paget, and Lisa Maria Vorpo. And I would like to start actually by introducing Anne Boucher, who is Director General at the European Commission DG Santé. But Anne has a wealth of experience in many areas, including the DG for Economic and Financial Affairs, and you've worked in structural funds, employment, enlargement. So she comes to health from all policies, one could almost say. And Anne, perhaps you can tell us a little bit about what the plans for the next 5 years are from the European Commission's perspective, what your goals and ambitions for health in Europe are. Thank you for joining us.
No, thank you very much, and it's a very intimidating audience of experts. Listen, I'm extremely excited to come and share with you a bit where we are in our thinking. As Isabel said, we're in transition. We hope to have the new Commission starting very soon, and the priorities have already been announced, and health is very high on the EU policy agenda. It's higher than it's ever been. So it's going to be very challenging for us to deliver on the priorities. Quickly, we have 5 priorities, and some are new and some are not, but with new momentum. I would go quickly through the 5 ones. The first one is antimicrobial resistance, which we consider will remain very high on the agenda. we have currently 100 deaths per day in the European Union linked to antimicrobial resistance. We had decided to be a best practice region with our action plan on One Health, which included human health, animal health, and environment. And the new step which we would like to address in the next 5 years is to pave the way for a global agreement on AMR.
Excellent.
And in the One Health perspective. The second area which was a priority and which will remain a priority at European level is vaccination. I think I don't need to convince anybody here that vaccination is the most cost-effective instrument we have in public health, and yet Europe is a global leader in vaccine hesitancy. And in 2018, the member states had decided to work more together to fight to improve vaccination coverage. And they have agreed on a roadmap and a recommendation which we will be implementing. And this includes in particular a coalition of health professionals for vaccination.
Which, as UFA, we are forming part of, I'm delighted to say.
Yes. No, I mean, we really hope that we will be able to get really all the representatives of the health professionals who will be able to have multipliers in the member states. The third issue is the digitization of the healthcare. We are at a stage where really we see a takeoff of digital technology in the area of health. We are doing many things, but the new priority which has been announced is to deal with the issue of health data. Mm-hmm. And we have committed to create a European health data space. And I think basically, if you look, I mean, there's a big challenge in mutualizing and using health data, which are so useful for making sure we get the full potential in improving health diagnosis, health therapies, but also policy making. Mm-hmm. And for this, I mean, we need to find a way to have a proper governance of health data. Basically, the General Data Protection Regulation has made very clear that health data belongs to the patient. But on the other hand, there are various ways of creating health data and even more diverse channels now with the new devices and with new actors in this area. And it's very important that we keep the possibilities of using health data for research and for diagnosis and therapies. So the issue of the secondary use of data will be very high on the European agenda. And we want to work closely with the member states, and we want to find the governance systems which provides the guarantees for the citizens that their health data are handled properly, safely, and in an ethical way. The fourth priority is cancer. And I mean, we know that it's one of the most important causes of death in the European Union. Currently, 40% of us are likely to develop cancer in their lives, and we all have experience of cancer in a way or another through friends and relatives, and we know how the pain and the difficulties going with the disease. So our president-elect has proposed to launch an action plan, Europe Beats Cancer. And we are basically preparing it. The ambitions are to work on the whole cycle from the prevention, detection, treatment, and survivorship. And the idea is to address medical and non-medical aspects of cancer. So we will be focusing on this in the next, I mean, have wide, broad consultations in the next 6 months how to join forces on this issue. And the fifth issue, which is not new for the member states, but it's the first time that it really comes on the top of a European agenda, is the issue of access to medicines, affordability, and shortages of medicines. I think we are at a turning point. We have world-class pharmaceutical systems. We have very high safety standards and innovation and research track records. But currently, we are having some tensions between incentives for innovation and equal access to medicines. And more countries face medicine shortages. And we find more and more unequal access throughout the Union to innovative medicines. So we intend to, there's not an easy answer to that issue. In particular, at the European level, we have limited competence, but we see ways of doing things. It has to be a mix of a wide range of measures, and that includes right incentives for innovation in regulation, medicine regulation. It includes also right incentives and obligations in the incentives, in placing medicines on the market. It includes to address the market failures in the single market. It includes to reduce dependency on third countries for global supply chains, in particular for API, where we import 80% of them from China and India. And we need an appropriate governance and transparency of pricing. We think we need more cooperation on health technology assessment, and we think we need also maybe specific measures to address specific segments of the markets, like antibiotics or like vaccines. Yes. And this is a mix of legislative and non-legislative actions, including research. So in a nutshell, that's the 5 priorities we're going to work on. And as I said, it's going to be in partnership. So, as we go along, we will be relying a lot on the contributions, your ideas, both for the design and implementation of these initiatives. Thank you.
Thank you very much, Anne, for sharing that with us. So you've heard them: AMR, vaccines, digitalization, cancer, access to medicines. Basically we cover all this range ourselves. I'm very interested also in the work that you'll be doing on the secondary processing of health data, because that is a critical point for many of our audience here who are very much involved in public health research and also exploring new methods of using big data. One small question, we know that this agenda would not have been possible 5 years ago. I think the scale and level of ambition has come a long way. We would like to think that as NGOs, our campaign to do more for health had some impact. But if I were to ask you, what do you think has really helped to put health at the forefront of the EU agenda in this different way to what we have seen in recent years?
I would say it's a whole succession of societal trends, and in that perspective, the European elections of May have been a turning point, because we saw higher participation than before, and we saw an unexpected increase in the Green Party's representation in the Parliament, and that reflects a perception in society that climate change and environment are big challenges, that they are challenges that a country on its own cannot meet.
Absolutely.
And that these challenges, citizens see it more and more associated to the risk on health. And I think, citizens, they perceive that the deterioration of environment is creating chronic disease conditions, lung disease, asthma. There's an increase in communicable diseases.
So in a way, by addressing health, we are also helping the EU to reconnect with its citizens.
And we also think that when we make surveys, we see very high health and food safety come on the top of the agenda. And so there's a perception of citizens that their lifestyles is unsustainable. And so we will be responding to these expectations. We are going to come out with a big Green Deal, which will cover different aspects of climate change and environment. Within that, there will be a farm to fork, which will look at sustainability not only from an environmental point of view, but also from a nutrition point of view.
Thank you.
Now, our counterpart, UFA, the Commission and UFA have been increasing the relations in the last year. I will say not ignoring each other, but not really working together at the beginning, and this has changed in the last year a lot, and it's now one of our essential partners. And Dineke Zirkers, I hope that everybody knows her, because she's the executive director of UFA, but she has been working with UFA for the last 23 years. So we would like to know more about this new strategy that you call the AAA, and that you are developing for the next 5 years.
Thank you very much, Isabel. I would like to take you on a little journey. So this week, the UFA boat sailed to Marseille. And we really enjoyed the sail. We've loved the boat. We've used the boat for 25 years. But, you know, it's time for a new sail. And we found a new sail in our new strategy until 2025. We also needed a new compass. Which direction are we going? And that, the AAA will help us do that. Now, first of all, you will notice it's a sailing boat, because obviously we have to be environmental friendly, carbon neutral, and we're following Greta Thunberg as an example. Imagine this boat sailing on a sea of research. So we're in the boat and we're trying to do the analysis. There's a lot of research going on, so you have to see which analysis, what research you're going to use for your analysis. And there's currently also new waves coming in the form of open access, a large call for open access, which will rock our boat. Now, don't get me wrong, we love open access. We think it's very important that everybody has access to research. But the risk is also that there's so much research, we can't find the phony research, or we can't find the fake news. This other problem with open access is that you have a risk of flooding and of drought. In Western European countries, people or universities are very well organized in getting open access through agreements with publishers. But there's other countries in Europe who don't have these agreements yet, and we need to be sure that we take these into account. Now, our European Journal of Public Health is a hybrid journal at the moment, which means you have to subscribe, but you can also have open access. And we're moving slowly towards open access, which is a big change for us. Because, first of all, our membership benefit of receiving the journal will go away, so we have to find something else. And second, we were very pressing for having the same format, just publishing research article without editorials, without commentaries, is not really useful for policymakers. So that brings us to the first A, the analysis. As I said, we have to exclude the rotten fish in research, and we have to make a very nice bouillabaisse for the policymakers. So they have the information in nice bite-sized formats, and they understand what we want to say. Coming to advocacy, can you imagine the sea turning into a sea of policymakers? And we are but one boat of many. And some of the boats are ocean steamers. They're so big, they're from commercial companies or professional lobbyists, and others are even smaller than our sailing boat. So we need to start working together. We need to start forming fleets of people, of boats who are in the same direction, who want the same thing. And the fleets can change. If we're talking about AMR, the fleet will be different than if we're talking about access to medicines. So that is something we need to watch out for. And the fleet, we've already done that, together with a lot of other European NGOs. We had EU for Health. We had EU Do More for Health. Now they're doing more for health, so now we want to be EU partner for health. So we're moving along with the European Commission here. So if we do it all right, we'll get back on the right track, back on the right course for a healthy population. And that brings me to action. Now, action is a difficult word for a European science-based organization. But we have to do it, because without research and analysis, there has to be action. So we need a favorable wind, and we're very grateful for our operating grant from the European Commission to give us a real boost in the right direction. And we also need an ocean of engaged public health professionals. Now, this may be difficult for us. We need to increase our skills. We need to listen to our network and to people. And we also need to innovate. We need to find ways of getting our members, our public health professionals, active. So this year, with the help of the operating grant, we launched the European Public Health Week. So 5 topics on public health in 5 days in May. And we were like, will it work? You know, will our members jump on? Will other people jump on? And it was an enormous success. There were 145 events in 35 countries, organized in 1 week. Well, that was a boost for public health. We're also trying out something at this conference, which is a public health escape room. Let's see if we can use the gaming to see if we can get people interested in doing something for public health or doing more for public health. Now, if you go back to the 3 A's, it's not analysis, advocacy, action, because from the advocacy and action, you go straight back to the analysis. You need to see, has it worked? Are there open questions? Do we need to do something more? Do we need to do something different? So it's a circular circle. And for that, we need not just the experienced public health professionals, but we also need the next generation of public health professionals. And I'm very pleased to have Sarah Mcqueen, of you from sitting next to me. So with you, together, we can sail to a future of healthy populations. Thank you.
Thank you, Dineke. This conference is about building bridges among different actors, different associations, different partners. So how are you, UFA, in practice implementing this concept of partnering for health, and not just with the European Commission, but with other partners?
Well, thank you very much for the question. Yes, as I said, we already have a lot of like-minded European NGOs like IFA, EuroHealthNet, ASFER, EMA. But we're going beyond that. We need to go to other population groups or organizations. We're including architects, we're including urban planners. We have worked with the occupational therapist and with the physiotherapist. So for every problem, you have to see who are your right partners to move things forward. And you have to think outside of the box. So not just think public health. I mean, if we're talking about cross-border health threats, it's not just talking to health people, it's talking to the people at the border. What can they do? How can they be trained to help in reaching, you know, stop cross-border health threats? So there's a role for us to step outside of our comfort zone and make sure that we work with as many people as possible.
Thank you very much.
And I think on this particular note, we can say that the Finnish presidency has really taken the bull by the horns and have stepped outside the traditional comfort zone. I would like to formally introduce and thank Liisa-Maria Voipio-Pukki for having accepted our invitation to be here in spite of the very hectic schedule and commitments. Liisa-Maria is the Director General of Strategic Affairs and Chief Medical Officer of the Finnish Ministry, which currently in Finland holds the rotating European Union presidency. And she's also the chair of the steering committee of the European Observatory for Health Systems and Policies. And your key theme has been around the concept of the economy of well-being. Can you tell us a little bit more about this and what made Finland interested in having this theme on the agenda, and how's it going as your presidency almost draws to a close?
Yeah. Thank you very much for the kind invitation. I'm very happy and honored to be here this morning. Yes, indeed, just about a month ago, the Council of the European Union adopted conclusions on the economy of well-being as the new horizontal approach to political decision-making on the national as well as on the EU level. And I think also it might have an impact also beyond the borders of the EU. It actually builds on the principles of the European Pillar of Social Rights, as well as on the health in all policies, which we actually introduced during the previous EU Council presidency in 2006, and One Health approaches. It supports the implementation of SDGs and calls for a new kind of intersectional cooperation of policymaking in real terms. Well, I understand that it can be a little bit fuzzy and confusing concept, but in short, it's all about investing in people as a prerequisite of social and economic stability. So people's well-being and sustainable economic growth are not contradictory, but mutually reinforcing goals. We find these interdependencies in health, in social protection, employment, gender equality, competitiveness, environment, education, you name it. So recognizing this does not mean that we compromise our core values such as solidarity, respect for human rights, social protection, universal access to care, and so on, safe working conditions, access to education, but it calls for addressing these issues also in economic terms. And I think that this is a lesson for us to learn. Recognizing incremental feedback loops between individual and societal well-being and sustainable economic growth. That's not been an easy path, I have to say, but when we were preparing these council conclusions, I never spoke to our Ministry of Finance as much as I did while we were drafting these council conclusions, and I think that is an achievement in itself. So health is an essential determinant and component of well-being, and ill health imposes a significant burden on society and public finances, in addition to its human toll, of course. But if you take the time and read the Council conclusions, you will come across with many familiar concepts, key public health concepts and developments. There are many, some people say too many, but we would like to focus on a few. And I'm here highlighting particularly mental health, healthy aging, and the digital transformation of health and social care. So there is no health actually without mental health. Good mental health improves people's quality of life in all ages, and development of mental health skills, which I personally think is quite important, enhances resilience and adaptation into the rapidly changing work and daily life. This was actually improve the lives of millions of people in Europe and beyond, and contribute to better working conditions and thus a stronger economy. This is an example of the positive feedback loops between health and economic performance. But also there is an urgent need to look at aging as more than just a question of the sustainability of the national economies. The common goal here for us all should be to deliver aging policies that enable active, healthy, inclusive, and independent lives as long as possible. Well, needless to say, the health and social care systems have an important role here, but we have also started talking about silver economy. In other words, of the elderly as part of the active workforce, consumers with their special needs and preferences, and also active participants in the civil society. And again, here we have a very good, actually quantitatively quite important example of the positive feedback loop. But as was already mentioned here, so we also think that digitalization and mobile technologies play an important role here, as they are changing the way that we can enhance, and people themselves can enhance their well-being, and how health and social services are actually delivered. But they also provide great economic opportunities for companies interested in the health sector, and this is perhaps particularly true for a post-Nokia country like Finland. So people's access to their own health and social data is an important element of patient-centered care and actually empowerment of people. And therefore, these techniques and approaches must be made as easy and user-friendly as possible. But having said so, we fully recognize the significance of data safety, security, solid legislation, and ethical principles when we also would like to promote the secondary use of health and social data for the purposes actually of public health, health systems governance, research, and innovation. And then I also had a sort of a different point here. I would like to emphasize that these positive feedback loops between the key well-being outcomes and economic performance, they're quite fragile actually. They need continuous surveillance and they may break down due to various kinds of shocks. So the World Bank has pointed out that the human capital is the world's greatest asset. But 65% of the global wealth consists of human capital. But in low-income countries, this is really much lower percentage. In the high-income countries, around 65, and in the low-income countries, close to 40. So as national economies do grow, the share of the human capital becomes more important. And therefore, I actually came to think that one size doesn't fit all. So we as Finland should practice what we preach, and being prescriptive does not particularly help. So context sensitivity and honoring the many challenges of political decision-making, as you already perhaps made reference to, they are actually the keys to success. But we have also, to be honest, observed that this concept is quite attractive. It raises interest, it opens doors, as most people somehow intuitively think that there is something in there. And the Council conclusions are just the beginning of something which we really do hope that will have an impact on the political processes in the future.
Thank you, Lisa Maria. But as you ended by saying, many people will be somewhat skeptical. Okay, well done. You've adopted your Council conclusions. We can frame them, shelf them, or we can use them as a basis for something important. And I can still trace back a set of Council conclusions I was involved in negotiating in the previous Finnish presidency many, many moons ago. And I think many of us in the public health field still refer to those Council conclusions very regularly. I'm talking about the values in health systems. I think those are some of the most cited Council conclusions that we can, that have been really, guiding. So, how can our public health researchers and practitioners have the same success? How can we replicate the success now that there was in 2006 with those Council conclusions on values in health systems with your new set of Council conclusions? How can we help them not remain on a shelf, somewhere?
Yes. Thank you very much for your kind words. Well, I would just invite you to learn more about these Council conclusions, read them, and there's a very good background document produced by the OECD. There are infographics, there are fact sheets that are available on the Council web pages, and also videos and presentations from the high-level scientific conference on this topic are available through the presidency web pages, so I invite you all to check them. But in practical terms, and as it has been mentioned already during this conference, the European semester provides a framework for the coordination of member states' economic policies, and it is an important tool also for monitoring for the implementation of, say, Europe 2020 strategy, key areas of the social pillar, and they all have common features with these Council conclusions. So we think that developing the European semester so that the assessment of national economies would pay more and more attention to people's well-being actually is a key component of economic sustainability. And actually I think that it needs input from the public health communities in the member states, so get involved in those processes. And there are quite many invites in those conclusions, and I would just briefly cite two of them. Continue to develop rigorous quantitative and qualitative data collection and statistical methods for measuring and regularly monitoring people's well-being in order to provide, together with the economic indicators in the context of the European semester, a comprehensive analysis for policy and decision-making. And actually I did pick one more, which might be a little bit surprising, but not anymore. work closely with the European national social partners and civil society to promote the economy of well-being through effective social and civil dialogue. And I wonder whether the public health community would be one of the best positioned to take this process forward. Thank you.
Thank you. We'll do our best.
Okay, thank you, Lisa Maria. And now, Sarah. If we are going to talk about the future of public health, we need to talk with the future of public health, because we are the past, or maybe the present still, but not the future. And things have changed, are changing a lot. When I studied public health, we were a minority, we were a medical doctor, all of us, not other professions, and we were considered as the strange people because compared with the clinicians that were the real doctors. So how are things changing, and which will be the skills for the next generation of public health professionals? Sarah Mcqueen is from the Dublin City University, and she's the coordinator of the next generation in UFA. Sarah.
Hi, good morning, and thank you, Isabella, for introducing me. My slide is ready. Let's press this button. First, I'd like to thank the previous speakers for their brilliant presentations here this morning. I'm very excited to be here to talk about some of the key skills that we'll need as a next generation of public health professionals. These skills may not be new, but we need to think about how we can start applying them as we build the bridge towards a future of public health in Europe. So skill set number one is adaptability and flexibility. I believe that once you start out on a path to becoming a public health professional, you perhaps unknowingly at the time also make a commitment to becoming a lifetime learner. These two skills, adaptability and flexibility, go in hand with one another. From our talks this morning, we can see that the field of public health is constantly changing, and we need to be able to be flexible and have the ability to adapt accordingly, or we could be left behind. The next skill sets are teamwork and communication skills. A professor once said to our class, in the public health world, you need to be a jack of all trades and a master of one. By its very nature, public health is interdisciplinary, wherein you mostly work as part of a multidisciplinary team. You will collaborate with a range of people, from policymakers to members of the public, to working in partnerships, as discussed here this morning. For me personally, I work with schools to increase the physical activity levels of teenage girls. So I need to be able to communicate to the teachers, the parents, and the girls themselves. So in short, you need to be a team player, and being able to communicate both in person and online is crucial. One of the aims of our Youth for Next Fellowship program is to improve the teamwork and communication skills of students and young professionals. As you might have noticed, at last year's conference and this year's conference, there are 6 fellows here who work together as a team to produce a daily journal and are very active on our social media platforms. So make sure to check them out and engage with them, because we can all learn from one another. The third skill set is experience. In today's society, it is expected that student graduates enter the workforce not only armed with knowledge, but also work experience that complements their theoretical learning. To quote Isaac Newton, he said, "If I have seen further, it is by standing upon the shoulders of giants." We as future public health professionals are well aware that we would not be able to make a contribution to the public health field if it were not for the public health professionals that have preceded us. When I was 21 years of age, I had the opportunity to complete an internship at the World Health Organization European office in Copenhagen. This incredible experience, where I got to network and learn from the experts, changed everything for me. And I'm grateful I had this opportunity so early in my career. The next skill set is policy development and advocacy. Policy development has been recommended by public health schools as another key skill for future public health professionals. And we can see that youth activism is increasing worldwide. Whether it be at a local level or a global level, from ensuring health in all policies to advocating for climate health, health inequalities or universal healthcare coverage, policy development and advocacy skills are crucial. Which brings me to my 5th and final skill, critical thinking, initiative and drive. Critical thinking is now considered one of the must-have skills for 21st century success. Developing the ability to think for ourselves and solve problems in real time will stand to benefit us today and will shape us as tomorrow's leaders. And having initiative and drive is an important element when it comes to being a self-directed and self-disciplined public health professional. Each of us needs to know what our passion is and what is it that drives us. I believe all public health professionals can make a huge difference to people's lives. We may be armed with different skill sets, but together we all share a common cause. We all want a healthy Europe in the future, and together we can all play a part in building the bridge towards this future. Thank you.
Thank you very much, Sarah. We have been talking in the previous intervention that there are different partners. There are many partners that intervene in public health. So there are different organizations of all kinds, health and others. How can the organization in general maximize the participation of the young people, the youth participation?
Thank you for the question. I think organizations could maximize youth participation by providing various opportunities for students and young professionals. So for example, providing opportunities within their organizations, internships, to present at various workshops, having dedicated skill building seminars for students, young professionals, and networking opportunities, either within their organization or at conferences themselves, and encouraging and supporting training for students, young professionals to develop on a skill set, as I discussed here this morning. Another way to ensure to have student young professionals would be to have maybe a network within the organisation themselves for young professionals, and to ensure that there's one representative on the boards within the organisations, for example, the executive board. With regard to conferences themselves, I think it's important to have reduced fees for students and opportunities for waivered fees, for example, the Youth Next Fellowship programme that I mentioned. And at conferences too, I think it's important to have students, young professionals as visible as possible, whether it be co-chairing sessions or taking leadership roles within the different working groups, or even like now being invited to be a part of a plenary. I think it all really makes a difference. And we as students and young professionals provide a unique perspective and a lived experience. And I think we are creative when we raise questions that are important to us as the younger generation. So I think the key take-home message for organisations is to acknowledge our potential contribution and to embrace having young professionals co-lead the way forward, and to provide, to maximise it by providing the various opportunities for our voices to be heard.
Thank you very much. Thank you very much.
I think one of the key themes that has emerged from all our speakers this morning is the need to work with others, the need to work with partners, whether it's working as part of a team, whether it's having to visit the Ministry of Finance more often than one would have imagined to get something done. And clearly, I think that even with the agenda that you have in front of you, Anne, as DG Santé, working with partners is going to be very important. On the other hand, we as public health are always very cautious about who we should be engaging with and how to also take into account vested interests and agendas. So how does one navigate this sensitive terrain of working with partners, but also then making it clear to what extent you can engage with certain commercial partners and where there is a boundary, and then the interests and objectives are different and engagement is no longer possible. I think this is one of the really critical aspects of engaging with partnerships. How are you dealing with this and planning to deal with it in the coming years?
No, you're right. I think it's one of the most complex aspects of what we have to do to deliver on our initiatives. I think we're making progress on having a common agreement within the health, among the health professionals, but also outside constituencies in health in all policies. I mean, I think the examples of the economy of well-being is one. I mentioned the role of climate change environment. For us, I mean, the Sustainable Development Goal have been extremely useful in putting in place a common framework for everybody with these 17 goals, of which 13 are related to health. And I think, I mean, now for us, the challenge, the way we see it, is to be able every time, at least in the health area, we launch a health initiative, is how to define the partnership and to identify the health constituency and non-health constituency which is relevant. So we are doing it for research, for instance, now, because we will have much more partnership. We want much more to bring the health, the public health in our health program, and also health authorities of the member states in setting our priorities for research. But we will also do it for cancer, for instance. The cancer plan, as I said, has to deal with medical and non-medical issues, so you have to bring probably social partners. That's the whole discussion we have in the EU on safety at work, but it's also the discussions which we have of reintegration of people after have gone through cancer. And so we need also to bring in the risk factors those, on the lifestyle or on the
Absolutely.
environment.
I don't think we can tackle cancer unless we are going to address again the determinants and drivers.
So for us, the Farm to Fork, which will look at the sustainability of the food system, will be a big platform as well, which will help the cancer discussion. So we see it for every initiative to ask the questions, which are the relevant partners and which are initiatives which will also support our objectives.
Thank you.
Dineke, sometimes I have the impression that we talk in an abstract manner. Maximum we think about the European level, the national level, but things happen at the local level. So how do we galvanize the action at local level?
Yes, thank you very much for your question. As I said already, it's for us very difficult as a European association to be active at a local level or a regional level even. And for that, it is very important that we strengthen our member associations, which are national public health associations or institutes of public health or even schools of public health. If we can provide them with the tools to take it further down one level, I think we can reach the action we're looking for. Thank you.
Lisa Maria, I wouldn't want the audience to leave without really having busted the myth that we don't need to remain with well-being as a fuzzy concept. So how can we break this down further? What advice would you give us? Because as you rightly said earlier, this has been probably the main criticism that you have faced. So how can we really counteract this criticism?
Thank you very much for the question. Main criticism so far, I would say. but in any case, so policies that take the economy of well-being forward must of course be based on data-driven, or even better, if I may say, real-world data-driven research to strengthen the knowledge base of the concept. But let me first say that we think that GDP is a critical and objective indicator of the economic performance, and very well so, but there is growing awareness of also its limits. For example, the GDP does not capture the broad range of elements that matter to people and contribute to well-being, or it ignores the distribution of these things across the society. But on that side, we already do have some indicators. We are not really starting from scratch. If I just may mention the Human Capital Index promoted by the World Bank, the economy of well-being is a broader context, but the human capital is an essential component of it. And also the OECD has already a few years ago published the framework to measure the material and quality of life determinants of individual well-being, population averages, and differences across groups. But I have to say that on the national level, we are quite actively discussing this question right now. And I do recognize the need to make compromises between academic rigor and what is achieved in real life for the purposes of political evidence-based or evidence-informed decision-making. And I think that how to combine the analysis of formal registry data, data mining, if I may say, and population surveys, that's the $1 million and dollar question.
So in a way, you are pushing us to think also about how we're going to use these new opportunities that are available perhaps even to update our traditional approaches towards data collection and measurement. And I think that's a real challenge for many public health professionals to take away, and also gives us an agenda to work on as UFA for our forthcoming conferences. So we'll keep a close eye on that one.
Thank you. I do really think that the digital environment where we now live is going to induce a paradigm change for the health systems and public health included.
Sarah, in this second round, we are trying to be down to earth and a touch of reality. And you have presented a series of skills that the new generation will have to have. So practical ways that you could try to develop these new skills, and how are you going to be our future in reality?
Thank you, Isabella, for the question. It's working. I think some practical ways could be to apply for the various internships, work experiences, and fellowship programs available out there. Even if the opportunity may be a bit daunting, like in my case, my advice would be to apply and just say yes to any kind of networking opportunities or opportunities where you get to learn. Another example would be to attend the various workshop trainings or skill building seminars available, whether it be at your institution or your organization, and to join the various networks and to meet new people and to learn from one another. For example, at this conference itself, there's various skill building seminars aimed towards young professionals to build on these skill sets. For example, tomorrow morning, there's a skill building seminar organised by my friends at UFA Next, URNet, MRPH, and Young Forum Gas Signers that focus on advocacy and policy making skills. So be sure to get there if you can.
So the network of next generation, the young trainers, you know that the Commission has those traineeship programs in all the European institutions. So to be more involved from the beginning is what you are saying, more or less. So that you need to work at the same time that you develop these skills and specialize.
Yeah, exactly.
I think that is.
Yeah. And we can all learn from one another. So if you attend the skill building seminars, we can teach each other and we can practice our different various skills.
Okay.
Thank you.
Thank you. Thank you, Natasha.
Thank you very much. I think that our panelists have given us a broad flavor of things to think of. We have an exciting agenda being put forward by the European Commission, and I think it's a real opportunity for all of us in the various areas we work with to link up. So moving perhaps more from just criticizing towards actively engaging and taking up the opportunities and helping to shape the course of implementation. Of course, this is not always coming so naturally perhaps to those of us who are more involved in providing the academic data, but over there again, Lisa Maria has provided us with another challenge, which is that of going back to our basics, epidemiology methods, and seeing how we can update them and make them more perhaps rapid, more timely, more contemporary, more in line with the needs of policymakers and the way in which society is changing. And then, of course, I think as UFA, we have demonstrated our commitment, even with our strategy, to be able to continue to be involved and to provide new ways of being involved too. And I'm sure we will continue also to try to support our member organizations and partners to have the courage to come forward and try new things too. And I think the operating grant has allowed us to do that quite nicely in the past years. So we look forward to continuing in this trajectory.
Yeah. As we said also yesterday, this is a job for everybody. So we need to have the researcher, the practitioner, the administrations at the different levels, the industry, everybody working together for the advancement of public health. And we will discuss next year again what we have achieved and how we are progressing, and we will progress in having better health for everybody in Europe. Thank you very much.
Thank you.
Thank you. Thank you.